Medical quackery. Poverty. Cultural norms and practices are major contributors to Nigeria's maternal death rate. I voyaged through 3 Nigerian cities: Niger, Abuja, and Kano. I found each harboring a distinct narrative. A study conducted by Nigeria Health Watch has shown that despite having one of the highest rates of maternal mortality in the world, many cases of women dying during childbirth in Nigeria are still underreported. The World Health Organization puts the maternal mortality rate in Nigeria at 814 deaths per 100,000 live births, and according to the 2018 Nigeria Demographic and Health Survey, 61% of live births do not take place in a health facility. About 20% of global maternal deaths occur in Nigeria, and more women, especially those aged 15 to 19, die from pregnancy-related complications. Between 2005 and 2015, it is estimated that over 600,000 maternal deaths and no less than 900,000 maternal near-miss cases occurred in the country. This is one of the most visited clinics in Peko Metropolis. Ill-equipped, yet patronized by many. Binta is only 17 years old. At this age, she has experienced the agony that comes with losing a child. In her case, the Fulani culture of shyness known as Pulaku led to her having a stillbirth. She labored for hours but kept mute.
So, ranar da suka kawo ta, sun kawo ta unconscious. Tana convulsing haka. Muka tambaye su, kafin ma mu fara taɓa ta mun tambaye su me sanadi abun nan, sai suka ce mana ai ta aihu ne amma ɗan ya mutu. Sai muka tambaye su bayan da ta haihu ne ɗan ya mutu ko ɗan ya mutu a cikin ne, suka ce a'a. Sun sha zuwa scanning ana ce masa ɗan lafiya lau, amma da ta zo haihuwa ta haifa ɗan ba rai. To mun tambaye su cewa lokacin da take naƙuda ta ɗauki tsawon lokaci kafin ta haihu, suka ce ta ɗauki tsawon lokaci. Muka ce masu to me yasa da suka ga tana ɗaukan tsawon lokaci ba su canza guri ba, irin su ga kaman cewa yanayin aikin asibitin bai abin ga masu ba, su canza wani gurin da za a iya taimakonta da gaggawa a yi savinta da yaronta. Suka ce to su ba su yi tunanin haka ba, tun da aka kai ta cikin labor room ana da dai ce musu su ƙara haƙuri da sauran lokaci. So sai mu kuma muka fara abin da ya dace mata. Muka yi duk abin da za mu yi muga ta dawo hayyacinta. Bayan nan mun gama hakan nan muka zo muka fara ɗan dudduba ta haka, muka zo muka ga alaman kamar tana da matsala a bladder nata. Akwai fitsari da ya taru sosai da baya iya fita a cikin bladder nata. Nan muka yi sauri muka yi passing mata catheter sau fitsarin ya sauka. Sannan muka duba cikin service ɗinta ko za mu ga tiye ko wani abu makamancin haka. Tabbas da muka duba akwai tiye sosai a service ɗinta. So doctor namu ya shiga ya ɗinki mata gurin da matsalan yake faruwa, haka ba ta treatment ɗin da ya kamata. Suka kai kaman kwana sati ɗaya dai suna nan ana ba su abin da ya kamata. So da muka ga jikinta ya yi kyau sosai sai muka sallame ta. So bayan kwana 2 kuma still sai suka ƙara dawo da ita suka ce ba ta samun fitsari. Din gaskiya ba mu so mu cire mata catheter ɗin a ranar da suka zo ba, amma su sun damu akan yarinyar ma, especially ita. Mun masu bayani to kin san Fulani wani lokaci suna da taurin kai, in suna so a masa abu ba a yi ba sai su ga kaman abin da ne. So dawon na biyun ga still ba ta samun fitsari, sai muka sa mata roba ɗin kuma still muna ba ta abin da ya kamata kafin nan, amma har yanzu tana on admission ba mu sallame su ko ba.
I requested she narrate her unpleasant experience, but because this is her first pregnancy, she was numb to the request. She asked her sister to be her spokesperson.
Al'adar mu Fulani idan haifuwar farko ne, wai kunya muke ji. Ba za mu faɗa ko sai dai wani ya faɗa. Ka san al'adar Fulani. Da farko dai ta fara naƙuda ba ta jin komai. A haka ta yi ne. Sai washe gari cikinta yake ciwo da baya ranar Juma'a. Mamanmu ba ta nan, ta dawo ta tarar da ita tana jin jiki, sai aka ɗauko ta aka kawo ta asibiti a nan ƙauyen mu a Nini. A lokacin ma da suka iso ashe ma bata sani ba, ta haifu a wurin nan, sai ta kama fisga ɗin nan, bata sani ba, ta soma, sai aka ɗauko ta aka kawo ta nan.
Given the fact that Niger State is one of the states where maternal mortality rate is very high, I visited another remote community where I'm told there's a woman giving birth. I had to hurry to catch a glimpse of the moment. I'm here in Shatta community, Rafinyashi, under Boso local government area in Niger State. I'm here on a visit, to a community clinic where a group of men are joining hands to save the lives of women giving birth. This woman labored for hours before she was able to birth this baby girl. In an unhygienic environment, a great number of women in Shatta come here to give birth. There is no provision for sterilization and infection control here. After birthing, the blood is thronged in a plastic toilet bowl using a local broom and plastic refuse pan. She has lost so much blood, roughly 5 pints, which is about 525 milliliters. Because a piece of the placenta remained in her uterus after delivery, she requires a blood transfusion. This hospital does not have a blood bank, so they apply direct blood transfusion after a few tests carried out with strips.
Pregnant women, we did antenatal. For my first time of coming here, we receive antenatal every day, more than 6 to 10 patients at every day. Mostly on Wednesday, we schedule antenatal schedule in Wednesday. We do receive like 15 to 20 sometimes. But if they face any health challenges, they have believed that the cultural treatment which affect them from denying from receive the healthcare services. We are liking of this immunization agents like tetanus toxins and other after delivering. We are facing challenges of the OPV, BCG, OPV, PCV, IPV, and the measles, yellow fever, and HPV. So we are facing challenge because of issue of the condition of the light. But we have other government clinic nearing to us because it's controlled by this ward. This ward is called what? Shatta ward in Boso local government. They are holding of the freezer, refrigerator for the maintenance of the competence of the BCG, those vaccines. I take recourse to them that we used to get the highest number of the delivering here, but we don't have access to immunize them from BCG or OPV. I don't think they did not respond for us. 80% of the children are suffering from the malaria during the rainy season. Some in the villages, they believe malaria is caused by a winch or any this thing, which lead to them to go for the herbal. Before coming to the clinic, it will look complicated. Some are anemia. But after they come to clinic for the anemic treatment, we hope we transfuse blood to them. But if you explain the materials need before transfusion, it will look costly for them. Due to the other treatment for the audience health workers that live in here, they didn't screen blood before transfusion. But if present now, as I'm posted to it, I try to explain how the blood should be screened before transfusion to them. They deny the causality of the screening, like HIV script, like hepatitis B, like hepatitis C, like the syphilis, and other, or if possible, malaria should be tested before transfusion, and other things. And group this thing, blood grouping, but they don't only know to buy blood bag and transfer to their this thing, to their other patient. Me, I didn't do that. Because if it's getting worse, I will just refer them to general hospital. Because if they reach that general hospital, they will listen to their information more than here as a village. Because they cannot comply with you because they think we are in village. But in general hospital, they don't have opportunity to even argue with the doctor or any other person. They will just write what they do to them, how they respond quicker than a village. So that's the challenges we are facing here.
Before going to school, I was here in this clinic for just 10 years ago. Because I stayed for one clinic for 5 years, here just like 6 to 7 years. So that one is just experience that those my ogas are telling me that this is how I go do, this is how I go do. That is where I gain my own experience to help them with this thing. If problem of parent, you get problem for the parent. As in, maybe you enter there and see how, if you look my body, you see how I look like, you know. Sometimes people are just coming here, as you see how I do that work. I finish the work, everything. The baby is normal, the woman is normal. Person go fit tell me, say, you give me 1.5. Even though I say I know we collect 1.5, they go become a dragging together with the man who carry the patient come. So, you know, we are here to just helping them. Not be say we are collecting money, much money from them. The person will understand us. If you say now, you give me 5,000 naira, person will just say, okay, you give me 4,000. Okay, you know that the man give experience. Okay, if I say you should give me 2,000 or 3,000, tell me say you will give me 1,000. You know that in day there is not any this thing. So we are here to helping them. Not be say that the money where they talk with him, now then they will give us.
This is the primary healthcare facility in Shatta, deserted. Many are devoted to this clinic for their medical needs.
We serve in 24 hours. That is why they prefer to come to our clinic. Every time they come to our clinic, they must mix a staff. They will meet a staff presently. And this clinic is building an olden days. You can see the structure of the clinic. It's old. So they are first utilizing this clinic before government to providing others clinic. To this area of the death, we still maintain antenatal 300 naira. If there's not any complication or order to fix drips, because drips is up to 1,000 naira now presently. But up to now, we still give routine draws of 300 naira. If the pregnant woman doesn't have any much complaint.
Baya da ka ba shi ba haya. Yijin godiya gabalo. Saboda yari yin boy. Sado yilo bi ta miyo shin. Yari ba da ba. Hanga ya ba biye shin nai. Kuma yijin godiya lo ba yi ka jo godiya hilo. Saboda ba mai shin lo. je ba asibiti ne ya ba ha laifin no ba gayo hakulubo to yi shi godiya gaba da boye shekwai da shi bugba ba da ko gaba hakuri ba shi kai ya ba da ba ne ba ha laifin no
na gwamnati na wani lokaci ba sa kwana a gurin ba sa zuwa wurin aiki da wuri kuma ka san mutane kawai wani lokaci muna zuwa gona mun fi so mu zo mu samu aikin sharp mu samu tare da doctor a gurin sannan shi yasa muke jin daɗin zuwa wurin asibitin
ba matsala ko bashi ya rage ne za ku bi na hankali mu biya ku ganin an wawale ba matsala
Maternal mortality rate and child mortality rate in Nigeria is high compared to other sister countries. Nigeria is the highest, one of the highest country. In Niger State, we cannot exonerate ourselves, but the state government has taken a lot of proactive steps towards addressing this. One, for the child mortality, is realized that 50% of death in children under 5 is as a result of malnutrition. Therefore, Niger State government, through a lot of other states, has taken variable steps to address that issue of malnutrition. So, and if we got that right, I believe 50% of our children will be safe from death. And you can see there will be a very big difference from our status quo. And that is why the government of this government now paid 250 million naira upfront to address this malnutrition through a series of World Bank grants. So wherever you go in Niger State now, necessary interventions are going on at community level to prevent this unintended death. For the maternal mortality, it's very high. The government, and we realize majority of women that die as a result of bleeding during giving birth. Another method that we also realize are a problem to the child and mother is lack of family planning. Family plan doesn't mean don't give birth, but space your children. Because even in the Quran, they will tell you wean your children for 2 years. But this is not what we're having now. People get pregnant unplanned. So with that, pregnancy is now planned so that women give birth, get pregnant at their own will, not unintended.
Known as one of the few purpose-built capital cities in Africa, Abuja is the center of politics and diplomacy in Nigeria. With a huge attribution such as this, one will anticipate seeing certain infrastructures working in favor of the common man, but that doesn't seem the case. Primary healthcare is essential healthcare based on practical, scientific, sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. Irene Emmanuel could not receive the care she required at a primary healthcare facility in Kubwa. She was forced to opt for a private healthcare facility that almost cost her life. Every mother anticipates the arrival of her newborn to nurture and care for it the best she can. But for Irene, that dream was shattered. She didn't even get a chance to breastfeed her baby.
It all happened on the 5th of November last year when I was due for my third scan. I normally register with primary health care. So whenever it's due, they will now refer me to general for my CX. So that is what happened that day too. They refer me because themselves they were on strike. So when I went to general hospital, they told me that there is no bed. That even people that register with them, they are just referring them. So I should just go back to that health care. So when I went back to that primary health center, I told the doctor that they didn't accept me because they said there's no bed. So the man said, okay, that we should not worry, that I have a doctor that he will call that is perfect, that he will do it well for me. That is a private hospital. Even my husband was asking him, do you know about the man? He said, yes, the man have done so many surgery that you know about him very well, that he will call him. So when he called the doctor came. So it's even the doctor that took us to his hospital. So after everything, they take me in for the CX. The CX was successful. I came out. But 2 days after the CX, I started knowing that my tummy started swelling up. I was not even comfortable with my body anymore. I was having pains within me. So they were just trying all they could just for me to pass out gas. But I could not pass out gas, nurse too. So after the 6th day, that was when the man said that they will take me in again for another surgery so that they can bring out the intestine and wash it. So that was what happened. The man took me in for another surgery. So after I came out from that surgery, the next day, feces started coming out from my body. I started passing out feces from my private parts, from where he did the previous surgery. It was just flowing uncontrollable. So the next day, he told my husband to go and buy adult pampers for me. That's what we started using. I even used almost 3 packs there. So I started losing strength day by day. I could not talk, could not even do anything. If anybody that came to visit, I would just be looking at them. So he now said that this thing is passing his power. He now referred me to Gwagwalada specialist. So when we get to Gwagwalada specialists, it's even by God's grace too, because there everywhere was filled up. I was inside car. My husband was just running up and down just to see the doctor. So they said there is no vacancy, that they should just calm down. So my husband said that this is an emergency because I cannot even breathe anymore. That this is an emergency, they should come and attend to the wife. So when they came, they saw my baby. My baby was just little to them. They now asked, whose child is this? They said, this is the mother. So the doctor now said, like, hi, this baby is too small to lose the mother. Let's see what we can do. So the doctor went in. Before you know it, they came out, they rushed me in. So when the doctors came, they now said that they will take me in the next morning for an emergency operation. So that was where they take me in the next day for another surgery. So when they take me in for the surgery, the next day they came to the ward. So they now told my husband that your wife is really a lucky woman, that what we saw in that theater, in fact, that's which doctor that did this kind of mistake, that the man mistakenly cut my intestine, that is by God's grace that I'm alive. Even when they went to the theater, that the only thing that they can do to save my life is to bring out that intestine outside, because if they say that they should be joining it, they will not make it. So that this intestine will be outside for 6 months. We were like, how are we going to manage intestine outside for 6 months? They said they will be using colostomy bag. And this colostomy, we are buying it 18,000 naira. Even we are buying it every 2 weeks. Because sometimes the thing will not even stay in my body to be removing. So we will be changing. It was not easy.
The doctor of Real Life Hospital that did the first surgery, the first and second surgery, he only called me the second day we left his hospital. Alpha. And I told him that, okay, they say they will be taking her in for another surgery this morning. That was the second day we left this hospital. And they said another surgery that's, okay, maybe they wanted to perfect this and that. So that was the only time he called me. Even the nurses in the hospital then do call us. Let me say on daily basis, at times once in 2 days. But this man, after that first call, he didn't call me again. And I didn't call him either. So those doctors in Ngogwalala were saying that this man is supposed to be coming here to see you and even to be giving you some assistance. But I think the way I was then, I didn't even have time for him. Let me just see that my wife is okay and out of this. Because I actually don't know where we're heading to then. We almost lost hope even before we get to Ngogwalala. She was as weak as anything. So after we were discharged on December 22nd, I went, maybe after some days, I went to that doctor, the real life hospital doctor, with some elderly men, two elderly men, seeking for his assistance financially if there is anything he can do for me. That I don't have much on me. That is the reason why I have to bring my wife back from the hospital. When we get there, the nurse we met there, I think she thought things were wrong. That maybe I came with police or whatever. Or maybe I came for violence.
I requested we visit the hospital where the cesarean was carried out to have a conversation with the surgeon doctor. Upon arrival, we were told he was not on seat, and the nurses we found had suspicious dispositions. Irene's husband decided to reach out to the doctor on phone, but he was furious.
Doctor sent me 10,000. 10,000 naira.
Resume here. We are not having issues. I'm telling you, our work is just temptation and devil work. Since we are here, our surgery is perfect. So I'm surprised I'm hearing this. Perfectly neat. We don't have challenge at all.
Since we
are here,
money where you spend, where this money is
surprised. I'm surprised our surgery
you can't
is
get
neat.
that money to
And
buy
no complication. So this one is intention.
With all the evidence before me, I decided to look up details of the hospital on Nigeria's hospital registry portal. It showed no records, although it had an inactive corporate affairs registration. According to Irene's husband, the doctor made a statement saying they should not be deceived by anyone, emphasizing that the surgical error could have happened anywhere and nothing could be done about it. According to a lawyer I reached out to, Irene can sue for surgical negligence compensation of up to 500 million naira. But because they have exhausted all they have, they can't afford a lawyer.
Over the years, especially in the recent period, we are witnessing emergence of professional derogations, professional insults In other words, practices that are repugnant to the tenets and ethics of the various professions. Take the case of medical practice, for example. We are witnessing situations whereby there are gross professional misconducts, whereby some people will undergo surgery, as a result of which there will be gross, incomprehensible neglect that has to do with the threatening of the lives of their clients or supposed victims. These type of practices are in gross violation of Section 33 of the Constitution, which is the right to life, and Section 34 of the Constitution, which is the right to personal liberty, the personal dignity. A human being needs to be treated with dignity, with respect, with honor, and with all that it takes as a bona fide citizen of Nigeria. If because of the class of someone, because he doesn't have sufficiency of money to pay for the best professional services, he is being dehumanized by the professionals that are supposed to know the best, then definitely the law should be the instrument to be applied for the rights and the liberties of these people to be redeemed. Clearly, it is in contradiction of the provisions of sections 14, 15, 17, 21, 23, and 24 of the Constitution for you to treat somebody on the altar of his class in respect to the right for the liberty, the right for human dignity to be treated as a bona fide citizen, especially when it comes to the matters of health. It is a damage that is unquantifiable. For example, it's threatening to life. It's threatening to life. There is no amount of money that you can talk about in terms of naira and kobo that threatening to life. But definitely, the culprit should be charged for manslaughter. The culprit should be charged for manslaughter. And regarding the quantum of financial damages, even if a quantum of, say, 250 million to 1 billion is given to the person, it's not too much in that context. But definitely, sanctions should be taken. He should be stripped of the license to practice as a medical practitioner, in addition to him going to jail.
Kano is a city in northern Nigeria and the capital of Kano State. It is the second largest city in Nigeria after Lagos, with over 4 million citizens. Located in the Sahel, south of the Sahara, Kano is a major route of a trans-Saharan trade. The city has been a trade and human settlement for millennia.
Gaskiya na fi son haihuwa a asibiti, saboda kaga haihuwa a asibiti ko da wata matsala ta faru, kaga su malaman asibiti za su faɗa maka su ce matsala ta faru, ko da a ce ba za ka iya haihuwa da kanka ba za su iya faɗa maka. In ka zauna a gida kam kaga ba abin da za a iya maka, wani ma ba zai gano me yake damun ka ba, a haka za a yi ta rashe-rashe.
Gaskiya na fi son haihuwa a asibiti, saboda ko da matsala za ta faru su suna da kayan aikin da za su iya yin maka agaji na gaggawa, to ba kamar a gida ba da babu, sai wasu wani abu ma ya faru a je asibiti ana ta complain suna cewa kaza. Gwara asibitin ka haihu komai ya kamata za a yi maka.
Mata suna yawan haihuwa yanzu, ana samun ballewar jini, ta haka ana samun yawanci rasa mahaifiyar yaro, sai dai a bar jariri. In ka ga asibiti ne duk da dai ba wai rai a hannun sai ka ba, amma suna ba da taimako yanda ba za a sha wahala ba tare da sai an zo an haihu a gida ana shan wahala ana kwasa ana tafiya asibiti ba, a zo kuma a samu matsalar da take kaɗan ta dawo mai yawa.
Duk wata matsala da za ta zo yayin haihuwa, kafin a samu matsala likitoci za su magance ta, amma idan a gida ne za ka ga an haihu an samu matsala, kafin a zo asibiti kuma ciwo ya riga ya ci.
A study has revealed that mismanagement of resources meant to salvage critical public health burdens has been responsible for persistent loss of mothers and newborn children in Kano State.
There are a lot of factors that are responsible for maternal deaths. First of all is the system itself. System in the sense that you have a health system that is not working. that is not programmed to be people-oriented, that is not programmed to see itself as service delivery. You see a health system that sees itself as if it is doing the public a favor. So, and therefore, the idea of investing seriously because of the life of the people is not there. So because we have to do this thing and then let it be part of budget, or this is also area where we can put a lot of money and being able to corner some for ourselves along the political interests. This is what you see in that system. And that is why you see that the health workers themselves are not well remunerated. There is a lack of facilities that could manage even minimal crisis that will allow a mother and a newborn baby to stay alive. So few health workers you have, they are overworked. They are not encouraged, they are not motivated, and there is no facility for them to work. So there is tension here and there. You leave your house, you come to work, the work is enormous, you don't have the basic tools to do the work, and yet you are not well remunerated. You also have your own personal challenges here and there. So the system itself is a major factor. Then outside the system, you also find the attitudes of the health workers themselves. So like I mentioned, because of this kind of orientation that they go through, the environment, they are not motivated, they are always hostile. And so some patients are they don't even want to go close to them. I don't want a son from this small girl or boy and all the rest. So they decide to stay away and rather want to have their babies at home. And when crises come, it becomes very difficult to manage such crises. And in most of the cases, we lose lives. That is part of it. Then you now find that there are some religious bigots who feel that, oh, because we are Muslims, we are this and that, so it is aberration for another man or another person to see the nakedness of my wife. You watch your wife suffer in pains and die. So that is also part of it. Some poverty. Oh, maybe if we get to the hospital, they will ask us to pay. And therefore, I don't have the money. You keep delay the labor. You become a protracted labor. At some point, when it cannot be managed at home, you decide, let's go to hospital. It becomes too late for anybody to manage such situation. So you have such. And then you have the traditional belief that people read all kind of meanings. That, oh no, you have to deliver at home. Some may even tell you that, oh, we are about 20 from my mother, 15 from my mother. My mother had all of us at home. So why should you go to the hospital? The international community has invested so much through MNCH2, through UNICEF and the rest. So, and the goal is to see that this scourge is curbed, because a situation whereby a mother who is trying to bring forth another life loses her own does not really sit well. Then the government itself has created a number of agencies like Kano State Health Trust Fund, Drug Revolving yes, a number of them like that. What CRISED is agitating for now is for that free maternal and child health care executive order to be formally legislated as law in Kano State, so that no government will come tomorrow and wish away all this gain that have been realized since 2001 when that executive order was in place. You find that there is no evil data to say that somebody delivered today, the government has a record to say that, oh, at the end of every week, the Commissioner for Health has at his fingertip the number of deaths we recorded in Kano State, the number of births that have been recorded, the number of maternal deaths. Do you get what I'm saying? Whether the person died in the hospital or not, there is no law now, as far as I'm concerned, in Kano State that says that before you bury anybody, you must register that death.
From the health budget trend above, resource allocation in the health sector has remained below 6% from 2013 to 2018, which is far less than World Health Organization recommendation and Abuja declaration target of 15% allocation as a proportion of the national allocation agreed by the African Union heads of state in 2001. Not only is it below the target, but it is also reducing as a proportion of the national budget. The budget release has been a huge challenge for MDAs under the Federal Ministry of Health, including National Primary Healthcare Development Agency. The table above shows budgetary allocation and releases for National Primary Healthcare Development Agency from 2017 to 2018 as presented by the representative of the Executive Director in the 3rd Annual Summit of the Legislative Network on Universal Health Coverage held in Abuja in November 2019. According to the UN Population Fund, Nigeria loses about $1.5 billion in productivity to maternal mortality annually. Nigeria is on the bad spot on the world map as a place where women are on death row while giving birth. Improving maternal health requires the collaborative efforts of varied stakeholders, including the media. These key players must work hard to ensure that available resources are judiciously used to minimize the death of thousands of women during childbirth. Maternal and child health care is critical to the development of any nation, prompting its inclusion in the Sustainable Development Goals. Nigeria cannot lay claim to development when its infant and maternal mortality rate is on the increase.